When a patient comes in, we'll go up to the front and grab them, and we'll bring them back to put them on one of the tables, and we will set them up according to their starting treatment, like we showed you in the previous videos. And then we will kind of keep track of them throughout their entire workout. We'll keep their charts on this counter. This is the aid counter, and it also has these drawers filled with the equipment that patients might need for various exercises. And we just kind of help get them the equipment they need based off of what it says on their chart, and we'll just make sure they're doing their exercises correctly and that they're not at risk of hurting themselves. Our main job as aides is to help the patients, so be sure to always be watching them.
I really want to emphasize here what Megan just said, that you should always be watching the patients while you're at the aid counter. Please do not have your back turned to the patients. Oftentimes I notice things before aides do, and that's a big problem because I'm not always even in the gym. So make sure that you are the eyes and the ears of the clinic. If you see anything going wrong, or patients are uncomfortable, or exercises need to be corrected, please do that. If you are unsure about it, then have your therapist help you understand what you can do to do better. Patients should rarely, if ever, be sitting down or doing nothing. So the only time they should be doing that really is when they're resting from an exercise. Your job is to help them get through things quickly. So you need to find that balance where you're giving patients some autonomy and letting them be independent with their own program, but also that you're giving them the coaching that you need. And at the start, when they're first coming in, their first few visits, you need to be more one-on-one. Patients who are having a new plan of care will need more one-on-one time from you and from the therapist. So expect that you will be giving more one-on-one time.
In certain situations, we will have patients in the back rooms if they have an injury that requires a little more privacy. So we'll always be sure to set timers here so that we can make sure that we're keeping an eye on them. And then when they're in the rooms and we set them up on something, we have what's called the rip cord. And basically we'll hand them this cord, and if they need anything or if they're in pain, they can pull it and it will alert us out there to come and check on them. The other thing with patient care is it's our responsibility to let the therapist know where they're at in a workout and know what they can do to best help the patients, and kind of help the therapist make their jobs a little bit easier.
Overall clinic flow will look something like this. So initially you will bring the patient back, and then you will set them up on their starting treatment and take a subjective from them, which Megan mentioned. The next thing you're going to do is you're going to write the subjective note. After doing that, you should update your therapist if there are any changes, and at that time the therapist may change what they want you to do for that day based on what the patient has told you. After you inform the therapist, you should prepare their exercises and get that ready for them. So that way, once they're done with their initial treatment, they can start right into that, because the next thing they're going to do is their exercise program. Now at this time, the therapist may want to work with them directly immediately afterwards. If that's the case, then you can have everything ready for after that. While the patients are doing their exercises, it is your primary job to watch them, coach them, and teach them. So make sure that you're doing that. That is a key part to being an aide. And then once they're done with their exercise program, you need to ask the therapist if there's anything else they would like them to do for that visit for the day. And that way we don't miss anything. So once they're done with their exercises, there's nothing else. If they have an ending treatment, then you need to set them up on their ending treatment and finish by escorting them to the front desk and helping them get rescheduled. So those are the steps to the patient flow. You need to get really good and efficient at them so that they're not here for too long of a time. We want our patients to be here around an hour. That will help them feel like they're getting what they need, but then they're not being here for too long.